Hello, Study Nurse IQ family. Welcome back to the channel. I'm Jenny, and today we're tackling a major topic in mental health and medical nursing: addiction and substance use disorders. This is a topic that requires confident and precise nursing care. So, we're going to break down the key terminology, dive into the specifics of alcohol, opioid, and stimulant use disorders, and focus on the priority nursing care you'll need for your exams. Please stick with me to the end as we have NCLEX style questions to test your knowledge on the material. Key terminology. Before we get into the nitty gritty of the specific substances, we have to understand the language of addiction. There are 4 essential terms you must know. First, there's intoxication. This simply refers to the symptoms you see when someone has excessive use of a substance. It's the acute, immediate effects, like when someone has slurred speech after drinking alcohol. Next is tolerance. This means that a person requires larger amounts of the substance to get the same desired effect that they used to get with a smaller dose. Their body has adapted, so they need more and more to feel it. Third, we have dependence, which is the physical or psychological need for the substance. Physical dependence is when the body actually requires the substance just to function normally and to avoid the painful physical symptoms of withdrawal. Psychological dependence is when the absence of the substance causes significant emotional distress or anxiety. The mind is reliant on it. Finally, we have withdrawal. This refers to the uncomfortable, sometimes dangerous, physiological symptoms that occur when a person suddenly stops using a substance or significantly cuts back. These symptoms are often the opposite of the intoxication effects. Let's talk about alcohol use disorder, AUD, the safety risk. Alcohol use disorder is prevalent, and managing withdrawal is a top priority for nurses because of the safety risk. Intoxication. Signs of acute alcohol intoxication include things you might expect: slurred speech, an unsteady gait or lack of coordination, facial flushing, and impaired judgment. Withdrawal, the critical timeline. Alcohol withdrawal is a true emergency because of the risk for seizures. You need to know this timeline for the NCLEX. 5 to 10 hours after the patient's last drink, withdrawal symptoms usually begin. They may experience early symptoms like tremors, insomnia, anxiety, GI upset, palpitations, and headaches. Symptoms typically peak around 24 to 48 hours. This is where the risk for seizures skyrockets, so we must be vigilant and prepared. The most severe complication, delirium tremens or DTS, can occur about 48 to 72 hours after the last drink. DTS is life-threatening and involves terrifying hallucinations, severe tachycardia and hypertension, and profuse diaphoresis, sweating. Treatment and priority nursing care. Our goals are always to stabilize vital signs and prevent seizures and DTS. Medications. The gold standard is benzodiazepines, such as diazepam or lorazepam. These are given to calm the overactive nervous system and prevent seizures. Other meds may include anticonvulsants and beta blockers, such as atenolol, to manage the high heart rate and blood pressure. Nutrition. We also administer IV fluids and electrolytes. Because these patients are often malnourished, they frequently receive a multivitamin, folate, and especially thiamine. This is to prevent serious complications like Wernicke's encephalopathy, which is a degenerative brain disorder caused by thiamine deficiency. Priority nursing actions. Your first nursing action is to ask the patient, when was your last drink? This helps you anticipate when their symptoms will peak. You will also use a screening tool like the CIWA, Clinical Institute Withdrawal Assessment for Alcohol, to objectively track how severe their withdrawal is. Since they are at risk for seizures and falls, implement seizure precautions, assist them with ambulation, and provide a quiet, private environment to decrease stimuli and help them stay calm. Abstinence promotion. We promote long-term abstinence by offering referrals to support groups like Alcoholics Anonymous, AA. We also encourage cognitive behavioral therapy, CBT, to help them develop better coping skills. Medications like disulfiram, acamprosate, and naltrexone can also be used to help maintain sobriety. 3. Opioid use disorder, the breathing risk. Opioids, which include street drugs like heroin and prescription drugs like oxycodone, morphine, and fentanyl, are central nervous system depressants. Intoxication and toxicity. Signs of intoxication include confusion, euphoria, excessive sleepiness, and the telltale sign, pinpoint pupils. The danger with an overdose or toxicity is severe respiratory depression, which can quickly lead to loss of consciousness and pallor or cyanosis. Remember, naloxone is the essential antidote for an opioid overdose and must be administered immediately to reverse the effects of the opioid and restore breathing. Withdrawal. Opioid withdrawal is intensely uncomfortable, but unlike alcohol withdrawal, it is generally not life-threatening. Symptoms are the opposite of intoxication and include agitation, sweating, diarrhea, an increase in heart rate and blood pressure, pupil dilation, mydriasis, and insomnia. Treatment. Treatment focuses on managing chronic use and recovery through opioid replacement therapy using medications like methadone and buprenorphine. These help control cravings and block the effects of other opioids. We also recommend support groups such as Narcotics Anonymous, NA, and individual or group therapy. For stimulant use disorder, the cardiac risk. Stimulants, such as cocaine and amphetamines, are central nervous system excitants. Intoxication and toxicity. Stimulants put the entire body into overdrive. Intoxication signs include euphoria, extreme alertness and energy, tachycardia, and hypertension. Toxicity is dangerous because of the high demands placed on the heart. Signs include severe insomnia, panic attacks, hallucinations, tremors, diaphoresis, convulsions, and serious dysrhythmias. Crucial safety note: stimulant use, particularly cocaine, places an individual at risk for sudden cardiac death because the drug causes vasoconstriction and extreme stress on the heart muscle. Withdrawal. Withdrawal from a stimulant is often called a crash and is characterized by a rebound depression, agitation, depression, profound fatigue, nightmares, and an increased appetite. Treatment. Since there are no specific pharmacological treatments for stimulant withdrawal, the focus is on psychological support, including cognitive behavioral therapy, CBT, and support groups. All right, Study Nurse IQ family, it's quiz time. I've got 5 questions to test your knowledge. Question 1. Blank refers to the physiological symptoms that occur upon discontinuation of a substance. Answer: withdrawal. Question 2. A patient withdrawing from alcohol is at risk for seizures and hallucinations. True or false? Answer: true. Question 3. Confusion, euphoria, and pinpoint pupils are signs of intoxication from what substance? Answer: an opioid. Question 4. Toxicity from what substance places an individual at risk for sudden cardiac death? Answer: cocaine, a stimulant. Question 5. What medication is used as the antidote for an opioid overdose? Answer: naloxone. If this video was of value or added value to you, please head to our YouTube channel Study Nurse IQ and click subscribe. Thank you so much for watching, and I will see you in the next video.